Hi everybody, this is Dr. Hall in here. Welcome to this lecture. We're going to go to the next topic of chapter number 6, cardiovascular conditions and disorders. We're going to focus in chronic heart failure, which is the number 4 on the list on the book of National Strength Condition Association training for special population, and we're going to go deeply to this topic of chronic heart failure. We're going to start with the abbreviation chronic heart failure is CHF as a medical terminology. That's the meaning, CHF of chronic heart failure, and the definition is basically the inability of the heart to circulate adequate blood to meet metabolic demands, resulting in fatigue or dyspnea. Chronic heart failure can be different in terms of origin. It can be the systolic format or diastolic format. Both forms, the left ventricle is going to be impaired to properly contract or properly relax. The systolic form is lower than normal contractibility with ejection fraction less than 35% of normal of left ventricle, and diastolic from the left ventricle is going to have the inability to relax. That's the difference between these. Now more about chronic heart failure. Something different between the systolic and diastolic is that systolic people have reduced the ejection fraction, and diastolic have the normal ejection fraction but lower stroke volume. We can see in the slide the parameters of ejection fraction according with the American Heart Association, the AHA. Normal are between 40 to 70%. Those are good numbers. Borderline ejection fraction are in the window of 41 to 49%, and reduced ejection fraction is above 40. That's bad. Okay, now chronic heart failure can be ischemic or non-ischemic. Ischemic is the result of an ischemic process. Ischemic is the lack of blood flow and oxygen to the heart, and non-ischemic is the result of other pathology such as a chronic hypertension. Two important factors in these individuals are this one: there are less stroke volume, and the sympathetic system is overactivated. It's overactivated to maintain blood pressure in the body. And the other factor is the heart is contracting more than needs, and it's going to be contracted more than needs, and over the time it's going to cause the muscle of the heart to hypertrophy, but not in a good way. Now we want to continue with this one, and the hallmark of the symptom of people with chronic heart failure is severe exercise intolerance. And what happened is due in part to lactate accumulation, but at low exercise levels. For individuals, fatigue is going to appear soon when exercise, and the lactic acid is going to build up. We must consider this situation, for example, in our exercise program design when we're going to work with these individuals. About medication, we're going to move to that topic, and we can see in the slide the table 6.4. Sorry. We can analyze the common medication used to treat chronic heart failure. There are many drugs, many meds In here, it's important to understand the side effects because that's going to impact your exercise choices and your exercise program design. We're going to summarize the list of meds in the next slide. We have in here the list of medication is large and similar to other prescribed for different cardiovascular diseases and disorders, such beta blockers, diuretics, and ACE inhibitors. Beta blockers are going to lower the heart rate. Diuretics reduce blood volume overload, and ACE inhibitors reduce blood pressure and dilatate blood vessel. But another med in here for chronic heart failure is digoxin. Digoxin, the effect of digoxin is going to increase myocardial contractility to compensate for the low stroke volume. Sometimes these individuals will need a special device implanted. The pacemaker is going to help to normalize the heart rate rhythm in case of cardiac arrhythmias. Other fact in here is mandatory evaluation, medical evaluation, and it's mandatory to have baseline data like graded exercise test with gas analysis and identify the anaerobic threshold. That's going to be the reference for exercise program design. We must consider for people with chronic heart failure, maybe they're going to have lower exercise capacity. They are going to get more tired, and the fatigue is going to arrive sooner with them. They need to breathe more. So if we have the result of the exercise testing to figure it out, the exact value of lactate threshold, we will know the response to exercise to design a safe and effective program. We will know the point on exercise when become fatigued the person and give us an idea about the intensity to stay just below the moment that person is able to exercise without fatigue. Now in here we have the physical exercise recommendation and parameters for chronic heart failure. These individuals are in aerobic exercise and resistant training are similar to other diseases. The table 6.7 and 6.8 are summarized the parameters. We can slowly analyze it in page 192 and 193. But we're going to talk more about it in the next slides. We're going to start with aerobic exercise, and we must remember lactate threshold is going to be the dictator and give us an idea of the intensity we must use to stay below fatigue. The exercise prescription parameters are like other cardiovascular disease. The frequency is better to do regular exercise 4 to 7 days per week, and we must involve large muscles. The duration 20 to 60 minutes per class is recommended. The intensity is important parameter. 40 to 70% of VO2 max or heart rate reserve is recommended, or with another tool like for example the RPE, the rate of perceived exertion. 12 to 14 is recommended, or maybe if you use the modified scale, 4 to 6 of the RPE is recommended. Other modalities like performing HIIT, high intensity interval training, can be effective for CHF individuals, but are those who are medical clearance. Now we move to resistant training guidelines. Are similar to other cardiovascular conditions and disorders. The frequency is 2 or 3 times per week, full body, but here we using 1 set per exercise in circuit format. 10 to 15 repetition are good. The intensity is a window between light to moderate, 40 to 80% of 1 rep max, and the rest periods between sets of exercise is 30 seconds or less. Always we must take time for develop a long warm up and a long cool down. It's important to prepare the persons for exercise. And finally, remember to better understand the topic of clients with chronic heart failure. Go to the book Essentials of Training Special Populations. Read the key points, read the key terms, answer the study questions, and carefully analyze the case study that is very close to the reality. If you are going to serve a chronic heart failure individual, remember the intensity is a good factor. Go focus on the anaerobic threshold and the lactate values, resting and exercise. See you in the next lecture.